Yeah. Okay, welcome to the Board of Health City of Revere meeting for the month of September. Would everyone please rise for the Pledge of Allegiance? Great, thank you. So my name is Dr. Drew Bunker, Chairman of the board, and with me tonight are the two other board members, Kathleen Savage to my left and Viviana Catano to my right. And then we have also municipal staff Lauren Buck, Director of Public Health, Michael Wells, Health Agent, Director of Inspectional Services for our meeting tonight. Tonight, first topic will be the review and approval of the minutes from the meeting from last month. So just ask the other members of the board to approve those minutes.
I approve the minutes as stated.
I approve of the minutes.
Great, thank you. Next is the Public Health Communicable Monthly Report with Lauren Buck.
Thanks, Dr. Bunker. For the month of September, we are seeing relatively low numbers of communicable diseases. Our COVID-19 rates are creeping up. We had 64 confirmed cases and 19 probable. This is expected this time of year. And then just two updates from the CDC that I thought were interesting to share. From September 12th, new CDC population data from 2023 shows that in 23 states or more than 1 in 3 adults, or 35%, has obesity. So before 2013, no state had an adult obesity prevalence at or above 35%. Currently, at least 1 in 5 individuals, 20%, in each U.S. state is living with obesity. It's a complex disease. Many factors contribute to obesity, like genes, certain medications, poor sleep, gut microbiome, stress, access to affordable food, safe places to be active, and access to healthcare. Understanding these factors helps identify potential prevention and treatment strategies. And just highlighting Massachusetts, this is CDC level data, so we can't highlight Revere specifically, but we can talk about the state of Massachusetts, which has a 27% prevalence of adult obesity. And our two highest ethnic groups that have the highest prevalence of obesity are our non-Hispanic Black adults and Hispanic adults, which have a prevalence of obesity at 35 to 40%. Next, from the CDC on September 10th, a new CDC vital signs report released highlights the role that conditions in counties such as insurance coverage, broadband internet access, and household income can play in lowering suicide risk. Compared to counties with the lowest levels of these factors, suicide rates were 26% lower in countries with the highest health insurance coverage, 44% lower in counties where most homes have internet access, and 13% lower in counties with higher household income. These findings reinforce other studies that show that the conditions where people are born, grow, live, work, and age can play an important role in shaping suicide prevention efforts. Suicide rates have increased during the last 20 years and remain high. Tragically, more than 49,000 people died by suicide in 2022, and provisional data indicate a similar number of people in 2023. So I just wanted to highlight those two news articles that came out of the CDC this month. Thank you.
Great, thank you, Lauren. Next is the Inspectional Services Monthly Report with Michael Wells.
Thanks, Dr. Bunker. Inspectional Services Monthly Report for September is as follows. Interior Housing Division, we performed 179 certificates of fitness. Those are largely for the new Amaya complex at Suffolk Downs and the relocation of the tenants from 364 Ocean Ave to 388 Ocean Ave. We performed 25 re-inspections on certificate of fitness. Interior complaints received or in process, we have 10. New complaints, 2. Interior complaint re-inspections, 2. On the Food Inspection Division, we performed 27 routine inspections, 6 re-inspections, 5 complaint inspections, 3 pre-opening inspections, 18 temporary food inspections. And on the Exterior Sanitation Division, violations issued, accumulation of litter, garbage, trash, and debris, 86 violations. Carts out at improper times, 2 violations. Commercial vehicles in residential neighborhoods, 1. Overflowing dumpsters, 52. Improper placement of garbage, trash, and bulky items, 391. Improper signage on public properties, 4. Improper storage of garbage and trash, 37. Junk heaps for automobile graveyards, 7, and multiple unregistered vehicles, 3. Unclean, unsanitary land, overgrowth vegetation, total of 74 violations, and working without permits, 1 violation. That concludes the inspectional services report.
Great, thank you, Michael. Next is the summons to appear. This is a second request for Kimberly Paula at 89 Augustus Street. This is in regards to chicken keeping violation.
So, thanks, Dr. Bunker. This is the second time we've asked the owner of 89 Augustus Street to come before the Board of Health regarding a violation of our chicken keeping ordinance here in Revere. We continue, Mike and I continue to receive regular complaints through our 311 department that Augustus Street there are chickens running around Augustus Street, there are in people's lawns, on the street, a clear violation of our ordinance. We have worked with animal control. We have gone to Augustus Street. We have knocked on doors. We have sent letters. We have done everything we needed to do. This is our second request for the owner to appear before the Board of Health. But unfortunately, this means we are now going to be taking this into a step further with the help of our animal control officer, Anthony Masiello, and we will be going to court and subjecting her to the appropriate fines and whatever they decide that they need to do there. But unfortunately, she is completely unresponsive and in clear violation of the ordinance. So that's where we are with that.
If I could note, this property is being fined $300 a day as well.
Great, thank you. I think the last part of the meeting that we're going to discuss was a notice of violation appeal for building 838 Winthrop Avenue, but we're going to postpone that. Or Michael, I'll have you talk, actually.
The owner has not shown up as of right now for that.
So owner is not here for the appeal. Okay. Are we going to make any decision on that regard? Or
Unfortunately, the building commissioner is not here as well. He had something come up and could not make it to be able to speak on his order.
okay, all right. So we'll postpone that for next meeting then, when we have the building commissioner. All right. That will conclude this month's meeting. Thank you very much.